I know when you all see a big smile like this on my face, you think it's nurses on set. But no, this is season 2 and I'm also excited every time we have a professor on set. And welcome back to the show, Professor Hutchinson. Yes. Right?
Yeah,
JP, welcome again. As
course.
usual, we have our professor in psychiatry with us. So, Prof, we're jumping back inside again. But this time, you know, I have my theories. I have a new theory for you today. You all have a new theory, JP. You have a new theory for them. And the theory is that with the whole COVID-19 pandemic, maybe the problem, the underlying problem really isn't COVID-19 itself. Is it not the health of the people of Trinidad and Tobago and the people of the world that is the real issue? Because here's the theory, was that a lot of the people that we saw that were dying, JP, or getting really ill, were people who were having underlying health issues. So what do you think about that?
Yeah, well, you know, that introduced the buzzword comorbidities.
Right, you
I didn't know what it was before. Before the pandemic, I never knew that word.
But you hear that word, don't you, Prof?
Comorbidities. Yeah, so definitely, I think and again, I think the emphasis on COVID has tended to minimize the significance of these comorbidities. Because the people who are getting sick, the people who are more likely to die, are the people who have their diabetes and hypertension and cancer and those non-communicable chronic diseases. And I think we have tended to neglect that, again, suggesting that, okay, vaccination is the solution, but vaccination by itself is not the solution. It has to be attack on your best health, you know, really trying to make yourself as healthy as possible. And in doing that, even if you were to get COVID-19, your chance of surviving it, your chance of overcoming it is much greater if you're healthy. And I think we haven't focused enough on that, on health,
I think we're missing that too, JP, because I've been seeing all the different campaigns of get vaccinated, about COVID-19, but I think we're missing the whole, I haven't really seen a campaign of take your vitamins, make sure you're exercising every day, make sure you're eating well, those things.
I think we've been doing that, but as Prof was saying, not enough, because I think we've probably been a little bit distracted, as we would do with the pandemic, right? But what I think the key thing is that it's not so much that we should do one or the other, we have to do all together, right?
Yes.
I think that's your whole point.
Yes,
because
and they have to be integrated.
Because to me, it's almost like The Matrix, or, you know, you saw a movie, right?
Right.
Or Inception, right? Yes. And even Inception was worse than that. That was like, it blew my mind. But I think it's all like a three-legged race almost. Because to me, it's to deal with COVID and the pandemic is to deal with non-COVID and the pandemic. So therefore, you have to do one to do the other. And we haven't been doing that, because to do it, it should be vaccine health. I don't say vaccine anymore. I say vaccine health, and you're saying it entwines with physical health as a focus on that. So it's more like a multi-system approach.
Yeah. And in addition to all the preventative things that Rome mentioned, I mean, even people taking their medication for their diabetes and their hypertension and checking their pressure and checking their blood sugar. And again, I think because the parallel health system, we've also tended to shift the focus on the COVID health system rather than the general health system. And again, I think that has contributed to some of the morbidity and mortality that we've got from COVID.
Prof, why I mentioned that too, and JP as well, because you're in the healthcare system and you all being doctors, is that I don't want that all the focus in the world right now is on COVID-19 and we miss the health issue. Because I was having a conversation with a friend of mine, and he was telling me he doesn't want to take the vaccine because he feels as though the way to go about it is what we were talking about. Make sure you're healthy and you're eating well. And what I had to remind him was that we are in an emergency situation. So the thing is, yes, you have to live a healthy lifestyle, but right now, in order to quell this whole fire that we're trying to fight, that's why you would see they would more push the vaccines. But listening to his point, I think that while we're fighting this fire, in terms of your multifaceted approach is what we had to be mindful of. So if we have one team focusing on, all right, we're driving the vaccinations and we want to encourage people and give them the information to make their decision, a right decision. But we also had to be mindful that we also encouraging the population that, listen, we have an issue here worldwide, not only in Trinidad and Tobago, where people are living unhealthy lifestyles, and we could give them some of the tips to live healthier lifestyles. So if we are faced with another pandemic, it wouldn't hit us as hard. Because I could use myself as an example. When I did contract COVID.
Since the pandemic began in March 2020, we have been taking cover and protecting ourselves using the regular and established protocols. Washing hands, wearing masks, watching distance. We now have a grand opportunity to push back at the enemy through the use of vaccines. Vaccines will give us hope for reducing fear, anxiety, and resistance. They will allow us to assist the poor, the needy, and those who are vulnerable. Receive the vaccines as they are available. We are longing to return to worship, to pray, to sing, to give God thanks in a safe environment, and vaccines will allow that. I am fully vaccinated, and that allows me an extra layer of protection and confidence to do my work. I appeal to you. Receive the vaccines as they become available. Consider and respond positively. We must move on to normalcy. Let's do our part. Let's vaccinate TNT.
I did contract COVID-19, and when I got it,
you got COVID, man.
so when I did contract the virus, I shook it off because I'm fully vaccinated. But not only am I fully vaccinated, I would be taking care of my health all the time. I would exercise. A day wouldn't pass without me exercising, eating right, that sort of thing. But I had a friend who, he was fully vaccinated as well, but he wasn't living the healthiest of lifestyles. And the effects that it would have had on his body were very different to mine. So while I would shake off the symptoms in a day or two, he went through like a full 2 weeks of the fever and the full thing. So I felt as though we missed that point.
Yeah, definitely. But I mean, going back to that though, is it difficult to do both systems? Because I actually see it from the level where if I was in authority in terms of in government, it'll be difficult to do. You got to put money towards the reality of the pandemic, and still to do the non-COVID systems, that's difficult to do, Prof, at the same time.
Well, I think, again, the health system has tended to focus on the secondary and tertiary care. And I think that we haven't, again, put enough emphasis on primary care and health promotion and prevention.
So you're saying the pre-COVID system wasn't doing enough.
To address those issues. I think when people get sick, the idea is, you come to us and we treat you and send you back out, as against addressing the health measures that you could take to prevent becoming ill or prevent having complications of illness, which we still have a lot of complications of diabetes and hypertension. And
Right. But the public also, and I challenge the public about this, although we have yes, I admit, in terms of primary care, we could do more for those NCDs, we call it, right? But how can the public themselves do more for themselves in terms of take that responsibility to do more for their own health?
Well, again, I think it's about encouragement and about the understanding of the relationship, because if you're not healthy, it means you become much more vulnerable to everything, and not just COVID, everything. And in terms of your general function too, you're gonna have less energy. You're not gonna work as hard. You're not gonna be as able to enjoy life as somebody who's healthier. So I think it's you know, going to age as gracefully. You know, so there are lots of benefits to paying that additional attention to your health. And again, I think we've taken health, inclusive of mental health, for granted. And again, COVID has kind of illustrated that our sensitivity about the value of our health isn't as good as it should be.
And Prof, as you mentioned, sensitivity. It took me to, do you think the public is now desensitized when it comes to us hearing about people dying from COVID?
Yeah.
Because every day we hear it, and it seems as though it's just another flash of the news.
Oh yeah, I think that's, and again, that is the native COVID, where it's kind of impersonal and anonymous. It makes it even easier to be desensitized. But I mean, that's again a long-standing psychological reality, much in the same way as we become desensitized to violence and crime, and
Right, of course, yeah.
you know. So the daily reports and the way it's presented in the media, I think might have also contributed to that desensitization. I know sometimes the idea of the human experience and perhaps getting people to really talk about it more, talk about the experience of having COVID, and helping other people understand, and in that way be able to empathize with the experience, I think might be something that's necessary now.
Because it had me worried, JP.
Yeah.
I thought, well, Trinidadians, we became cold and heartless, and because last year, when the first person died, it was like, oh my God, the whole country was talking about it. And now, you have a couple of people dying every day, and it's just a number. And I was like, are we becoming cold, heartless people, or if it is?
Well, you see, and I think it is the consequence as well of the restrictions that the pandemic have. The response to the pandemic have forced upon us. I think life has to go on, and people are starting to feel that they need for their lives to go on, they need for their lives to resume, and as a result, that creates a sense of detachment from, you know, the realities of COVID and other realities as well, until and unless it comes
Fits you
home
right
to them.
there.
Yeah.
All right, so we're going to head across to our mindfulness moment to give you some peace and serenity in your day.
Hello and welcome to your mindful moment. Today I'd like to do a little mindfulness tip for our kids who are out there, and I'd like to introduce you to my belly buddy. So he's going to help us today. So we're going to be using our breathing again to help us with our mindfulness and to keep us anchored in the current moment. So if you have anything like a teddy bear or a stuffed toy or something that's soft with a bit of weight, like a pillow or a blanket, it's going to be really useful. So what we're going to do is to put our belly buddies on our tummies, pretend that I'm lying down. This works best just before bedtime. And what we're going to do basically is just close your eyes, and you're just going to breathe into your tummies and feel your belly buddy rise. And then release that breath and feel him fall. Good. Do that one more time. Just breathe into your tummy and feel him rise. Good job. And then release and let him fall. And then one more time, just like that. Deep breath in and out. Great. Your belly buddy can be a great companion to use before going to bed at night. It helps to get big worries out of your heads and get you ready for sleep. So remember to use your buddy and be here now.
It's Rome, and we are here. We're chilling with the boys. We're liming with the kids. We're doing this all for the PED Cares Foundation. So we need you at home watching us to go donate. Head over to the pedcares.org and send that donation, whether it's via credit card, direct transfer, because we want to make sure that the kids of our pediatric emergency department get the best possible care that they can get, because we need to take care of the next generation. The future lies with the kids. You all ready? On three, we go and say yeah. 1, 2, 3. Yay! Hey, the PD Cares Foundation. All right, so we're back from our mindfulness moment. And JP, you had an interesting take on this one.
The thing is that what I want to share with you and Prof is that in my family, we have a strong family history of diabetes and hypertension. So much so that one of my aunts is actually almost blind. So I'm also aware about the point that the Prof is making, that I'm aware of me trying to make sure I live a longer life, and I want to be living a healthy life. So I check up all the time and focus on my physical health, yeah? So it's really important.
And Prof, what you mentioned as well in terms of, before we cut to the mindfulness moment, was about opening back up and getting back to life. Because we thinking about this thing, last time we did season 1, we thought by the time now, this whole thing would have been over.
Sure.
And then now we are heading into, this will be almost at the end of 2021, we're heading into 2022. This would be our 3rd year now of this, and we don't know how long is it going to last. So do we have to take a moment and say, okay, we need to get back to life. And we have people out there with comorbidities, and they just need to weigh their risk, balance their risk. What do you think about us opening back up, getting back to life, as well as balancing the risk of us having citizens with us with comorbidities and those who are not so healthy?
Yeah, I think it's inevitable. I think we have to, because wholly outside of the economic tool, I think there's also a big mental health tool. And I think people I don't know that we can cope with too many more restrictions.
Right.
So I think it's really about finding that balance between allowing those who are vaccinated and who are healthier to find a way to live their lives as normally as possible, and protecting the other people as best as we can. But I think the future is that balance.
Right.
Because we can't continue with all these restrictions.
Yeah, because that's what I'm thinking. I'm like, how many times are we going to go back into a lockdown? Are we going to live like this forever?
Yeah.
Are we never going to go to an event or have a carnival ever again because of this? Because I don't see COVID-19 disappearing anytime soon. So I think we would eventually have to open back up. Yeah. And you're right, Doc, we had to balance that risk. As well as JP, you were mentioning, if we know that we have comorbidities, we have to be mindful now of living a healthier lifestyle. And you were mentioning the 5 pillars.
Yeah, I think this is our wake-up call in Rome. I know that initially last year we weren't certain with COVID pandemic, and now we're talking about vaccines and we're saying to protect yourself with that, but I'm saying that we also have to wake up to the fact that we have to make ourselves healthier. So my 5 pillars, we have public health. So all those things we spoke about, wash your hands, wear your mask, etc. We have vaccine health. Take your vaccine, get your information, listen to the boy in blue, get your information. Then we have physical health. Those comorbidities, you have to manage yourself in conjunction with your doctor. Then we have immune health. Make sure your immune health is up to mark. And as Prof, that's why we have Prof here, mental health. So we're talking about those 5 pillars. I think it might be where we wake up to the fact that we have to focus on our general health now, those 5 things. Yeah.
So not only as JP and as Prof was saying, we think that, well, and I was thinking this from the jump, is that yes, COVID-19 is real, it is here and it is a threat, but the underlying issue is the health of our population, and not only our Trinidad and Tobago, Caribbean-wide, but worldwide, is that we need to get that out there. That I came from a background of engineering, and my master's was in preventative maintenance. So I always believed in that. Prevention is better than cure. And I always feel as if this pandemic hit our society where we were a healthier society, we wouldn't have been in the situation where we are now. So
and it's continuing, eh? Our pandemic is going until next year or further on. I know, Rome, you weren't happy with that. I know, I'm telling you. So this is an opportunity. WHO says until up to at least December 2022. So we have this year. We need to get on track. I think it's time for our population to make an effort.
We need all hands on deck. So we need everyone to do what you have to do, and we live a healthier lifestyle moving forward. So yes, we would encourage people to make your decision. I mean, you all know my stance. I would encourage you to get vaccinated, as I did and as all of us did, and as all of our families did.
Definitely vaccine.
But we're not forcing it on you. We want you to make the decision based on the information that you would get. We would give you as well, and we would discuss some of those issues. But not only that, we would encourage you to take care of your health. Make sure you get exercise. Make sure you take care of your mental health. All of the 5 pillars that you would have mentioned.
Because it's all entwined, as it
everything ties together. So, ladies and gentlemen, we want to thank you very much for joining us once again for a great episode of Homefront. And remember to donate. Head over to pedcares.org. You can swipe your credit card. You can do a direct transfer, touch the pocket a little bit, and give us a little donation. It's Rome for another episode of Homefront.